Radiopharmaceuticals are an intravenous or oral treatment that can deliver radiation very specifically to tumors, either through targeting via antibody linked to the radioactive material or through the intrinsic chemistry of the radiopharmaceutical product.
So Pluvicto would be ideal for any urologist caring for patients with stage 4 or medical oncologist caring for patients with stage 4 prostate cancer. Happy to have that discussion to see where they are along their journey as far as treatments they have received thus far, and what treatments must also be tried before you consider a radiopharmaceutical agent like Pluvicto.
So working with referring physicians is just the same as all other oncology collaborative work, where we refer patients back and forth to each other. Someone has a patient they think might benefit or they know would benefit from it, and they would refer to the radiation oncologist, who would evaluate them, agree, discuss the options with the patient, and take care of the delivery and the issues surrounding the delivery of the treatment, and then work long-term collaborating with that physician in terms of caring for the patient as needed.
So there are several select criteria for Pluvicto treatment, and this is primarily based off the trial that was conducted to seek FDA approval. In that trial, the patients must have metastatic castrate-resistant prostate cancer who have received androgen deprivation therapy along with an androgen receptor pathway inhibitor, and must have received chemotherapy. Apart from these three, the patient must also undergo a PSMA PET scan to determine avid sites of metastases before proceeding with Pluvicto.
That indication may change and is likely to change in the next year or two to allow it to be done even if the patient has not had chemotherapy, but current guidelines require a patient to have already had chemotherapy. Certainly for now, it will always be hormone therapy first, and then after hormone therapy, this might become the next step in the future, but for now it's after hormone therapy and prior chemo. When it comes to Lutathera, it's similar. After first-line drug treatment for the neuroendocrine tumor is not working anymore, then Lutathera is an appropriate next step to consider. So Lutathera and Pluvicto are given for different diseases. So Pluvicto is for prostate cancer, and Lutathera is for neuroendocrine tumors. Their administration is also different in that Pluvicto is a very simple IV infusion over a few minutes, whereas Lutathera, it's a much more involved administration because there are a requirement to give amino acids prior to the drug itself in order to protect the kidney. So it's a much longer process and much more involved.
Pluvicto is a medication that falls under the category of radiopharmaceutical ligands or radioligand therapy. Essentially, it is a very targeted molecule that binds to prostate-specific membrane antigen, PSMA. This is quite commonly found on most prostate cancer cells. Majority of prostate cancer cells exhibit this on their surface. We try to exploit that mechanism by latching on to that antigen. Then the drug molecule gets internalized, which is bound to an atom called lutetium, which then delivers the radiation to the tumor cells.
I think the most important thing is just for people to kind of be aware that these are increasingly being used and available to patients. These are relatively new compared to other cancer treatments, particularly Pluvicto is really on the market just for a relatively short period of time. And they are remarkably safe, and especially in the world of treating advanced or metastatic cancers where many of the treatments are quite toxic. These are remarkably low toxicity for their benefit. And just to know as well that there are many drugs in the pipeline, so there's a high level expectation that this will be an area of significant growth in many, including other diseases and other agents in the coming years.